Hello, everybody. Welcome to this LinkedIn and YouTube Live. I'm super excited to have Dave Federici with me today. He's possibly one of the most positive people I've met in terms of the sleep space. He's very enigmatic. He has a lot of experience dealing with people with sleep apnea. Is often doing public speaking on this. And we have 45 minutes to basically learn as much as you can about sleep apnea. I've got a list of questions that have been sent my way before this. To anyone who is watching this, I'm just going live on Instagram as well. To anyone who is watching this, if you have a question, then you can put it in the comments for the event, and we will do our best to try and answer that during this discussion. So if you could quickly introduce yourself, Dave, and I always have a cheeky question, which is, how was your sleep?
My sleep last night was wonderful, thank you. Thank you for having me, appreciate it. Good morning, good afternoon, and good evening to some of you. I know you're far-reaching, Matt. Pleasure to be here. Dave Federici. I'm a dental sleep medicine provider in New Jersey, which is in the northeast part of the U.S. I got started in this about 9 years ago because I was a severe sleep apnea sufferer. For me, I attempted to use CPAP machine for 2+ years with really no success. I was having 30 events per hour, which means every 2 minutes, the CPAP machine was raising up the pressure and fracturing my sleep. And at the end of the day, I was still tired and hitting the rumble strips going off the road. And I told my pulmonologist the treatment can't be worse than the disease. So what good is treating one thing if the side effects could kill you? So I moved on to make myself an appliance back then in the early stages of what they were. And it changed my life, the energy levels, the cognitive clarity. I said, I have to focus the rest of my career on helping other people who might be suffering like me. So that's my story.
And I'm right in thinking you're basically dealing with patients with sleep apnea on a nearly daily basis, right?
Absolutely. We get referrals. Most dentists will go through their patient pool and screen and treat. And after that, it's about collaborating with sleep physicians, pulmonologists, cardiologists, endocrinologists, OBGYNs, neurologists, all the people that are affected and their specific specialty that this disease has its tentacles in. And it's about collaborating and providing a therapy treatment that makes them better medical doctors. So.
And one thing that I think is really fascinating about sleep, and not everyone knows this, is that sleep's not owned by one group of people. Like with cancer, it might be mainly oncologists, doctors, but with sleep, doctors, dentists, psychologists, nurses, sleep technicians. It's because it's so impactful in so many areas. So there's so many little niches within it and areas that people just don't understand. So it makes it very complicated, but also very fascinating. And this is why getting your input on this in particular is very interesting, because I imagine very few people would look down the dental aspect or the oral appliances, especially when it comes to sleep apnea.
Absolutely. Awareness is the big component right now. We have still to this day in this country, medical doctors are given 2 hours the second year of med school on sleep apnea. We are the doctors of the oral cavity. And some of you may say, well, why a dentist in this? This is a medical condition, right? Well, we see patients twice a year. We're looking in their oral cavity for an hour at a time. You entrust us to screen for oral cancers, and those same tissues that can predispose, one anatomically to have sleep apnea, the ones we're treating and looking for oral cancers. So combined with the questionnaire, the comorbidities on their medical history, do they have AFib? Do they have refractory hypertension? Do they have acid reflux? All these things would be alarm signs that to go get studied. Unfortunately, medical doctors don't look in the oral cavity. A patient may come to them saying, I'm feeling tired, I'm sleepy. They'll do a blood panel. They'll maybe give them a B12 shot. They'll say, lose some weight. And it's like, we're asking to simply screen. And if those, red lights come up, get them a simple home sleep test, get it diagnosed, and then you can treat it. You're treating sometimes the symptoms, and we're not looking at sometimes the cause of these issues. So that's where the collaboration between all, healthcare providers, like you said, nurses, a lot of patients. I deal with a lot of nurse practitioners because they spend more time with the patients than the doctor. Patients entrust speaking to nurses more. They'll let more out than they will to a medical doctor. So it's just as important to talk to the nurse practitioners and the PAs, the physician assistants, as it is to the primaries.
Okay. So let's start from the very basics. I appreciate not everyone here has a deep understanding of sleep apnea. What is it in simple terms?
Simple terms is when you get to lay back down horizontally, as you get into deeper stages of sleeping and your tissues, your tongue, everything relax, the tongue will fall back against the soft palate and clog / stop your airway. And then the body has to react somehow. Sometimes it's a jolt. Sometimes you'll just turn over. The body can't tell your hand, hey, wake Dave up. He's not breathing. So several responses have to occur. And how one's brain and autonomic nervous system reacts to sleep apnea usually is how they're suffering from it. So if you have a young person whose autonomic nervous system is very efficient, it'll catch these things early and not let them stop breathing for more than, say, 10 seconds. Other people who have a slower response, they may stop breathing for 30 seconds. Their oxygens drop very deeply. The cardiac ramifications are, hey, the brain's saying, hey, heart, beat faster. We've got to raise the oxygen level up in this person's particular body. And there's a physiologic response. And many middle of the night panic attacks and rushes to the ER and saying, I think I'm having a heart attack. It's only because the heart is responding to the drop in oxygen. And by the time they drive to the hospital and get checked in and get on the EKG, everything's normalized. And they say, oh, you must be under stress. Here's a Valium. Well, what do these medications do? Further relax you, greater chance for that airway to collapse. So you're actually fueling a worsening of the situation, as are sleeping aids given to patients like Ambien and Lunesta. Before you have the disease, you might be accentuating its side effects by relaxing the patient more, which therefore allows the airway to collapse more frequently. Hence, you have a greater severity of the actual disease.
Mm-hmm. And you mentioned a few interesting points there in terms of medications. Like, the reason I'm really keen to speak to you on this topic is, as we said in the title, over 20% of people have sleep apnea. Many people don't even know they have it. So a lot of people struggling with sleep, they're feeling a bit shit, dare I say, and they're trying sleeping pills. They're trying random supplements. They're trying random things they've seen online, and it's not going to help because they've got sleep apnea. So that it's, I have mild sleep apnea, and I only even knew it, like, right. I'm 36. I only knew this about a year and a half, 2 years ago. So many years of my life, I must have been having suboptimal energy and sleep and not being able to do anything about it. In terms of signs, I mean, for me personally, I've had some partners who've told me, oh, Matt, you're snoring, and then you just stop snoring and you stop choking. Right. And I even sometimes have these dreams where in my dream, I'm choking. I'm like choking, I'm desperate for breath. And then I kind of wake up, and it's not a dream. It's actually happening. It's kind of scary, but a lot of people don't even have that understanding. So they're just waking up feeling bad, and they don't even know why. So I don't know if that's a good explanation, but that's just from my personal experience of apnea.
Yeah, it manifests itself differently. Like you said, there's a lot of studies being done on the neurological aspect, and people think that they have neurological issues. So neurologists and psychiatrists are seeing patients and saying, I'm having these weird dreams, like I'm suffocating, I'm drowning. And that's actually, they're finding out the brain is creating. So again, it can't smack you to wake you up. It does send a signal to the heart to beat faster, but at some point, creation of a nightmare. And there are actually people who sit bedside, and these people wake up with these random, consistent nightmares and say, what were you dreaming about? Oh, I was swimming. I could barely get to the surface. So that is you depriving, you're actually dry choking is what we talk about. And that's the way you create a nightmare. And that's how the brain, how unbelievably it works, is waking you up thinking that, and your heart's racing like it was the response to the dream, when actuality, your brain woke you up because your heart was beating faster because you stopped breathing so much that your oxygen levels crashed. So awareness is the number one thing. Is don't run to a doctor thinking I've got psychological issues. We have older patients who are suffering from this, think this is early onset dementia because they don't have cognitive clarity in the morning. They wake up with hypoxic headaches. They think it's grinding or migraines, and they're given migraine medication when actuality, it's just the oxygen levels dropping. And when you deprive the brain of oxygen, you get these hypoxic headaches. So it's got like I said earlier, its prongs and its tentacles in so many specialties. And it's important for each one of these specialties to have obstructive sleep apnea testing on their radar before you get into more advanced treatment options, right? That's the key.
Yep. And I think for a lot of people, I speak for myself, you're just scared. because we don't know much. There's not much communication about sleep apnea. The only things people know maybe is about CPAP, which is where you basically get put on like, it's like a machine around you. It's like Darth Vader style breathing equipment. It hasn't got the greatest rep. So a lot of people just don't even want to go any further just out of fear of that. But ultimately,
you're right. We just had this discussion this past week, and we were doing a mastery program in the faculty, and it's like, patients are aware of sleep apnea and they say, there's no way I'm going to wear that CPAP machine. Therefore, I'm not even going to go get tested. Right. And there was 1,000 men study done and said, had I known, they were asked, no, I know I have it. My wife says I snore. We sleep in different beds. She's caught me stopping breathing, but there's no way I'm going to wear it. Had I known that there was plan B and C, like an oral appliance and different forms of therapy, I would have gotten tested and I would have treated this condition earlier. So there's that communication aspect. It's on the medical side, diagnosis. Pulmonologists, sleep physicians are your number one, but all they can offer is CPAP machines because that's the gold standard in their minds. But again, you have to be cognizant of the patient's need. We have patients with PTSD and other issues, panic attack disorders, all these different disorders that they can't wear the machine. So what are my other options? Or they'll be given the machine. If I had $1 for every time a patient came into me and said, yeah, I was given a CPAP machine, there's no way I'm wearing it. It's been in the corner on the floor for 2 years. I mean, the cost just to the medical establishment for that, but not owning up to usage of it. And it's like, if the doctors have to be aware that if there's no way they're going to wear it, all right, I'm going to get you to a board certified dental sleep medicine practitioner to offer plan B. Or we have the hypoglossal nerve stimulator. Some people just can't deal with the air pressure. And that was my personal story, is the air pressure, when it ramps up, just detecting you're not breathing, the air pressure raises up is what fractured my sleep. So 30 times an hour, every 2 minutes, my sleep was getting fractured. I never got to the deeper stages of sleep, which we're going to talk about shortly, is like where memory compaction and neural waste of the day is ridded. If you're not achieving those specific stages, you're basically waking up with a hangover every morning, minus the alcohol.
No, I can relate a lot to that. It's happened more times than I can count. And there's obviously a lot more to it than just apnea, but it's definitely a massive factor for a lot of people.
Absolutely.
We got a lot to cover here, I feel. So I guess maybe the first thing is just, we've covered kind of the signs. So it's choking in your sleep, often snoring very heavily, waking up not feeling great. There's more we could touch upon, but I think that's maybe a good starting point. In terms of the solutions, like we can touch on the holistic ones later, but from the medical side, okay, people kind of know about CPAP, okay? But that's nearly all that a lot of people know. So you mentioned oral appliances. We can maybe talk about changes to the nose, dental aspects, operations to the throat, perhaps. Like, I'm not the expert here, so I'm curious. Like, what are the treatments people can take these days, and what's kind of considered best, or what could you kind of shine light on in this area?
Sure. Well, like you said, the CPAP, and there's full face mask if you're mouth breathers, and there's nasal, only type mask. And that's what most pulmonologists and sleep physicians are trained on. So that's going to be their first go-to. I'm seeing more and more now with my therapies that the sleep physicians are asking the patients, CPAP is the standard, but with your mild or moderate case here, if you don't think you're going to be honest with yourself and wear it consistently every night, because if you're not, it's not considered effective therapy, then we have plan B, which could be an oral appliance, which is what I do. Mm-hmm. Inspire have done a big job since the 12 million CPAP recall by Philips Respironics a few years ago occurred, and only ResMed is selling now, that they're looking for alternatives. Of course, it's a surgical implant. There's a breathing lead, a generator defibrillator placed in the chest, and then an incision made in your neck, and they attach a lead to the hypoglossal nerve. You activate it with a remote control. It senses you're not breathing. It sends a signal to the tongue to move forward. So our oral appliances protrude the jaw forward and brings the tongue with it to keep the airway open. Inspire, the hypoglossal nerve stimulator, electrically stimulates the tongue to move forward and open up the airway. So that's a surgical approach. So more and more insurances, unfortunately, now are stating you have to fail CPAP and oral appliance before we'll pay for the much more expensive Inspire surgery. So there are other, obviously, ways to treat it with BMI decreases. obviously the Ozempic, and there was just another study that came out that Zepbound from Eli Lilly drug came out, and it's the same classification as Ozempic. And they're finding out that once the patients lose the weight, that the sleep apnea severity is cut in half and sometimes 75%. So like you said earlier, you have it, I have it. We don't fit the typical historic build that it's a disease of the obese. There are 25%, and I have one recently, an anorexic woman who was this skinny, and she had a 60 event per hour, super severe index. So anatomically, we have to look with large tongues, narrow jaws. People aren't doing tonsil and adenoidectomies anymore. So there's extra tonsillar tissue in there now. So there's a lot of anatomical issues that need to be addressed, but there's more nasal studying being done now. Like you said, opening up the nasal passages. There's some sprays being done, potassium channel blockers down in Australia now that's keeping the tongue awake. There's another drug coming through phase 3 clinical trials that it's an anti-muscarinic for bladder control. And the other drug, it's a combo drug. And the other one is for ADHD. Somehow when these two are awake, they're keeping the tongue awake during non-REM and REM sleep. So again, it has a lesser propensity to fall back and clog the airway up. So there's going to be a multi-pronged approach going forward, that it's not just CPAP or it's not just surgery or it's not just oral appliance. Maybe it's a combination of those. So it's got a very bright future, and what patients want and need are options. And that's what we're seeing now.
Yeah. And that's good to hear, because I know a lot of people who they only were given one option. It's just take the CPAP machine or don't. And obviously there's way more to it than that. And it's good to see this progress. For me personally, I got septoplasty surgery done. So effectively, I could only breathe well through one of my nostrils. And this is not that long ago. This is November last year. So I was always whistling with one of my I'd have this whistle noise. It's terrible. And so once I had that surgery, my sleep has been a lot more consistent. I am having less of these wake ups, should we say. And then outside of that, I always find if I'm in a good consistency, if I'm low stress, another thing for me personally, and I'd be interested in your opinion, like eating well. If I eat healthy foods, if I'm careful what I eat, I find my sleep and issues with apnea diminish greatly. While if I'm eating crap, dare I say, especially late in the day, my sleep is always considerably worse. So I think there's so many lifestyle factors that boil into this as well. So I'm curious on your thoughts on the sort of holistic aspects of improving sleep, specifically for sleep apnea.
Absolutely. Well, we know alcohol is the number one contributor of relaxation. So alcohol, unfortunately, people are using alcohol to say, hey, it helps me fall asleep. You're right. It will make you tired. And then your sleep architecture is completely screwed up the whole night, which is why we have this typical hangover. So getting to sleep is sometimes an issue for patients that are using alcohol or added melatonins or some type of pill or something to do to help them fall asleep, not thinking about what the architecture is like. So a lot of people's architectures are poor just due to caffeine intake too close to bed, too much water too close to bed, where you have fracturing of your sleep because your bladder gets full. You get up in the middle of the night, you start thinking about tomorrow, and before you know it, your second half of your night is crappy night's sleep, right? So, sleep hygiene, less, obviously everybody's on their electronics, and that blue light, white light stimulates the brain and wakes it up. This part's dead tired, ready to go to sleep. So those are your, ways to put yourself in a better position to get a good night's sleep is your hygiene. Obviously, nutrition is a big one. You've talked about leptin and ghrelin on your posts historically, and they've done testing in people who have sleep apnea will gravitate toward the bad foods in the morning because they're so groggy and tired and poor night's sleep that they gravitate to the instant carb, and they choose the refined donuts and the crap. And the people who have good sleep, they gravitated toward the healthier omelets and the lean meats and things like that for their breakfast. Obviously people using stimulants to get through their day. How many cups of coffee are you taking? 5-hour energy drink? Are you taking naps at lunch? I mean, look at all these things that say, hey, you're masking the symptoms of sleep apnea. How would you function at your job 9 to 5 if I took away the coffee or the 5-hour energy drink? And most people say I wouldn't be able to function. So these are things on a questionnaire you need to ask and be honest with yourself, that are you masking some of these symptoms? So the holistic side of this is, like you said, what you're putting in your body, exercise levels. Do you have energy to exercise? We find people that we treat them, their BMI is starting to go down, more of a downstream effect, because at the end of the day, they have more energy to exercise versus sit on the couch, eat a junky meal, fall asleep, and then segue right into bed. So there's your holistic pathway, which I think is very important.
Yeah. And The way I see it is basically, okay, if you have sleep apnea or the signs of it, yeah, there's the medical side, CPAP, dental work, nasal work, potential throat areas as well. And then there's also, but even if you do all that, you're not helping yourself much if you're not doing losing body fat, changing your sleep habits, coffee, alcohol, lifestyle. One thing I'm a very big proponent of, and I don't know if it makes me popular or not, is sleep isn't fair. Some people just have great sleep. They don't have any sleep apnea. They can get by in 6 hours. They've got great genetics. Great. But if you're not one of them, which is a good amount of people, you can either like live like the others, or you got to do the work. You got to do the work to get the sleep that maybe other people will just get normally. And the benefits are just enormous. I'm maybe living proof of this. Like the changes in me in the last few years have been quite dramatic just by working on the sleep. So I'm guessing on that, I've got a question coming up that's been asked to me, but I have a question for you. Like, if there's some stories you can share from patients on a confidential level, with some of the changes you've seen in people's lives due to, let's say, some of the appliances, for example.
Sure. Well, to get back on your nasoplasty, a lot of people we send to get an ear, nose, throat evaluation doctor because they've had sports injuries in the past where they've had deviated septums or they've had polyps or turbinate bone issues. So, we like to breathe through our nose. We like to promote nasal breathing. The mouth was made to eat, the nose was made to breathe. But some people, when they lay down and turn onto a side, that side gets clogged, or they turn the other side and this side gets clogged. So if you only have one nostril effectively taking in air, now you've decreased your air intake by 50%. Is that flow enough to keep that airway from collapsing at night? So we have to think of the nasal component, right, before we even get to the throat and the tongue, because that's the gatekeeper, right? The tongue rests back. Our nose comes down and then meets the back of our tongue. So we need to get the tongue out of the way to allow the nose to get proper breathing. And that's where that mouth taping, which I know you want to get into, comes into play as well, as to have proper nasal airflow patency. But the amount of patients who, even with 50% reduction in their severity of their sleep apnea, are like hugging and kissing and saying, oh my gosh, we're sleeping in the same bed again after 10 years, or, bed partners. I have the energy to go out for a walk now and I'm not dead tired. Oh, I don't want to go out to dinner with the neighbors, but I'm just exhausted. The mental, you see an uptick. It's almost like somebody's been put on an antidepressant who's been depressed, and we've alleviated that cloud. And that's where people go to the neurologist and the psychiatrist thinking there's something wrong with them. And we're trying to make more inroads with them to get them sleep tested. It could be as simple as their airway is clogged at night. It's taking its ramifications on the brain, the way they feel in the morning. They have this dark cloud. Oh, I don't even become functional till 9 a.m. And you deal with a lot of high performing, corporate people. And we've talked about this before, about getting enough hours to be efficient during the day and getting the best sleep possible. Like you had mentioned, we had people say, oh, I get by on 4.5 hours sleep and I'm fine. They won't be honest with you what this last third of their day is like. But, we had talked before, like there's specific sleep staging everybody goes through, stage 1 through stage 4 REM sleep. And the average person takes about 80 to 90 minutes to get through those 4 cycles. If you're on 4.5, 5 hours of sleep, you might only get through 3 of those cycles instead of the typical 4. What's the ramifications of that? Well, they're finding out a lot of the neural waste of the day is ridded during those deeper stages of sleep. All right. So you have performance, cognitive clarity. You don't have this buildup of these tau proteins in the brain, which they're linking to early onset dementia, and they make you more efficient during the day because your brain, instead of having 75% charge, we talk about this on your phone, you're 100% charged. So if you're getting through 4 cycles of the sleep staging versus 3, you're going to be more efficient. You're going to be cognitively more clear in the last part of your day. And some deals and work, like, hey, I have people tell me I only schedule things for the morning after I have my 2 cups of coffee because my day goes downhill after that, right? So what are the performance of your employees? And we can go over Space Shuttle Challenger O-rings and Chernobyl and Exxon Valdez and these railroad train crashes. These were all affected by sleep deprivation and or fell asleep at the wheel or during their jobs. And, we have commercial driver's licenses need to have testing to see if these people driving our kids in school buses are not suffering from sleep apnea, right? The ability to avoid an accident, let alone falling asleep at the wheel. So the stories are amazing on when you treat these patients, no matter what the therapy. But that's the fulfilling part, is raising the clouds and just giving a more healthy perspective. And it's just amazing how you see the patients just do a 180 in all aspects of their life.
And for you personally as well, I mean, you have sleep apnea. So what's worked best for you? And you, like, what's the biggest difference you've seen?
Well, when the side effects of my CPAP machine was, like I said earlier in the intro, I was falling asleep in the second half of the day because I was sleep deprived. The apneas were being taken care of by the CPAP machine, but my fractured sleep wasn't letting me get to those stage 3 and 4 REM sleeps where you dream, and the cognitive clarity. So basically, dealing with untreated sleep apnea is like having a mini hangover. Yeah, you don't get the dehydration from the alcohol side effects, but cognitively, you feel like a mini hangover. So when I made my appliance, it's like, oh my gosh, people's like, how many cups of coffee are you taking? You're buzzing all around the offices. I was like, I have 1 cup of coffee, but I get a great night's sleep. And it changed my life at that point, that how that was the piece of the puzzle that I wasn't even really aware of. I thought it was me not being able to acclimate. I mean, you see PAPs are the gold standard. Why am I not responding? Is it me? And don't think it's always you. It's just your body and brain is responding to the mode of therapy. Just like a side reaction of a drug. It may work for you. For me, I have a side effect or this or that. So the doctors and the prescribing treatment has to sync up with the patient and make sure it's working. It's just not one size fits all. So that's where we come in, is like, we want to provide a plan B, or for first line therapy for mild to moderate. That's what we have a coalition with the American Academy of Sleep Medicine, is that we can be first line therapy. So again, we have severes who can't use the CPAP. We reduce them down to maybe mild formats with the appliance, and then we bring in positional therapy where we keep them off their back, or nasal dilators where it helps their nasal airflow, and all different scenarios. Like I told you, the drugs that are coming through the pipeline. So we're having more and more ancillary techniques to help these patients find the right combination that works for them.
And moving on to the question I got received. So I think it's becoming more and more common for children to have apneas, from what I understand. So there's more children who are breathing through their mouths. There's more children who are having nasal issues. There's more children that are having issues with allergies. And it seems to be like a new pandemic. And obviously parents will worry more about their children's sleep than their own. And this is why actually there's so much focus on children's sleep, especially in the coaching space. What are your thoughts on this? And is there any maybe advice you can give to parents, or resources that parents should be looking into for this?
Yes. So we have a pediatrics screener. So when we come in with the patients, and we always bring the mother or father back, we have them fill that out. Are you watching your child in bed? Do they lay up? Do they end up on the floor? Or do they kick a lot? Do they bed wet? Are they getting up to go to the bathroom many times a night? Are they having nightmares? Are they coming into your room, and they won't tell you they're having nightmares, but they'll say, I had a bad dream. So these are same things that happen on the pediatric side, but they don't know what they don't know. They're just reacting to a response to their body. So it's important for us. We deal with pediatric dentists who will work with us in doing a screening. As I said earlier, we're not doing tonsil and adenoidectomies anymore routinely like we used to in the old days. So that's more tissue that's in the pediatric airway. Skeletally, we look for narrow jaws, retrognathic jaws, which means their jaws are pushed back. And we deal with and work with a lot of myofunctional therapists, because some people are tongue-tied. They don't have right phonetics, speech. So we work with orthodontists that can expand the jaw and facilitate and open up the sinus in the airway to have a more accommodating space in their mouth for their tongue size. So yes, they do pediatric. They have CPAP machines for kids. We work with a local children's hospital here that they do overnight sleep studies for kids, and they have cute little CPAPs that have elephant trunks as the hoses, and the kids really respond to it. They're very accepting of it because the body is reaping the benefit, and it's not like they rip it off and say, I hate this thing. You know what I mean? But just kids can't communicate, and it's often misdiagnosed with ADHD because as the day goes on, they get tired, they fall asleep, they're wiry, they have cognitive issues and developmental issues. And the first thing the pediatricians want to do is put them on Ritalin and drugs. And it's like, give them a sleep study, right? See if they're suffering. Don't go the medication route. We'll see how the kid responds in 3 months, right? Because there's side effects, and who wants to put their young child on a medication? So this thing has to be screened and tested for just as importantly as early the data is showing that, about 5% of kids 5% of non-obese kids will have it. So again, kids are on video games more. We're seeing the BMI with this generation going up, and they're going to put themselves in the position to have thick necks, fatty deposited tongues, which could clog the airway up. So it is an under treated area, and we just ask parents in our case to look at this screener and see if your child is suffering from this, as well as cognitive issues in school or learning or developmental issues. And please do not go into the drug aspect until you roll out a sleep study.
Absolutely. And there's a few points to touch upon there. You mentioned phonetics, so speaking in a better way or more proper way, jaw positioning. From the holistic side, there are people talking about jaw exercises, strengthening the jaw, trying to improve your the sort of facial structure, basically. Is that realistic for adults as well, or is it kind of, once you become an adult, is it kind of too late for that?
Yeah, structurally, your bones and their sutures have fused more or less. I know there's some that are trying to do some palatal expansion for some people, but the lower jaw doesn't have a palate. So the problem is we have to flare the teeth to accommodate the new position of the upper teeth, and it can become an issue. There are some surgeries or MMA, maxillomandibular advancement surgeries, where they can actually move the jaw. So if somebody has a pushed in jaw, we call that retrognathic. Obviously, as the jaw comes back and is narrower, it's bringing the tongue back closer to clogging and make it more easier to clog. So there's surgical procedures that can move the jaws forward as well as expand them. As far as tongue-tied, I mean, at that point, they've already have their speech pattern. So there's really not much holistically you can do other than, not letting your tongue fall asleep is easy with the alcohol. I mean, we have people that can snore standing up when they have 2 or more drinks. So that airway collapses. There's no amount of sleep position you can change or something you can do holistically if the body is going to full relaxation mode under the influence, unfortunately.
Yeah. I mean, nearly every level, quitting alcohol is a no-brainer. Whenever I talk about alcohol, it gets a lot of attention. It might upset a few people, but at this point, I just don't care. It's like,
no brainer is fitting. No brainer is fitting, because you keep on this path, you will have no brain over time. We're finding out that turns the brain into Swiss cheese with too much alcohol. So, and we talk about white matter, and that's another hour for a different webinar.
Yeah, it's one of the most destructive things, and I think we just need to talk about it more. If people still, a lot of people still think it's a sleep aid, which it's just beyond not. So,
right.
Move on to another controversial topic. So I don't think alcohol's controversial between us. It's obvious it's not good for sleep and many things, but it's still controversial outside of this discussion. What about mouth taping?
Yes, very controversial. Obviously, there could be a few famous people internationally that will do it, and it starts a trend. Again, these people who do it don't have the disclaimer, this is not medical advice, or it works for me, but it may not work for you. And as we talked about earlier, if you have nasal obstruction and we're taping the mouth closed, yes, we're promoting nasal breathing, what we want. But the problem becomes is, do you have nasal patency or full airflow going through that nose? Because if you tape this and you clog one nostril, you now have 50% intake. And I equate this to the kids' birthday party bouncy gyms. There is a machine, a motor that pumps air through this. It keeps it inflated. If we cut that motor in half, what's going to happen to the play gym? These kids are jumping around and it's going to start deflating, right? So think of that as collapsing of the airway. If there's not enough airflow through one nostril, because we're taping this and we have a clog or restricted airflow, we're now depriving ourselves of air intake, which is going to make sleep apnea worse. So you must go through an ENT evaluation. My recommendation, again, people feel, hey, when I'm upright, I'm fine. It's not about when you're upright, because you don't sleep that way. It's when you lay down and you try a little test and you turn on your side and close your lips. Do you get enough airflow? Right now, that's when you first lay in bed. But what happens when we sleep is our respiration rate decreases, our tidal volume decreases. So we take much shallower breaths. So that one nostril is now maybe taking in half the quantity it usually does when you're awake. All right. And now you're asleep on your back, and a greater propensity for that tongue to not be able to be moved out by that lower intake of air through your nose.
Yeah. And I mean, the way I see like mouth tape, first I agree, it's being pushed very heavily in Instagram and TikTok without any sort of disclaimers or any backing. Like as of now, there's no scientific studies that heavily show it works. I also grant that there's none showing necessarily that it doesn't work either. It seems like there's just very few studies. They're all on very small sample sizes, mainly sleep apnea patients. So from a scientific perspective, like it's safe to say it doesn't work until it's proven it does work. And even from like, let's say, if people do find benefits from mouth tape, the best way I like to see it is if it does work, that's telling you something else, right?
Correct.
If mouth tape is improving your sleep, then that is suggesting that there's something going wrong in the ENT area, or you maybe do have sleep apnea. So I wouldn't, if it works for people, I'm not going to discourage that, but it should be creating more questions and solving answers, right? Because if it's working for someone, then they should be seeing an ENT specialist. They should be getting tested for sleep apnea, because I would suspect wearing mouth tape for your whole life isn't a sustainable solution.
No. You want to,
with the science we know so far, and that may be different in 10 years' time. It undoubtedly will be. So it's an interesting topic, and it's just, I mean, it's a bigger issue at whole is that people push sleep products online all the time without any, just because it's easy money, I guess. And I guess the regulations around this are pretty limited worldwide. So
absolutely. I mean, we know the nose purifies the air and humidifies it, and it's a good thing. And we know that when you breathe through your nose, you're going to get nitric oxide produced, because as the air crosses the paranasal sinuses, a small amount, and it hasn't been quantifiable, but we know nitric oxide's a vasodilator, it helps with cardiac issues, it helps with working out. So again, if it works for you and you've been cleared by an ENT, that you have great patency and you're honest with yourself that you don't have any allergies or clogging, because obviously on a night where you feel congested, and here in the Northeast in the US right now is a lot of yellow pollen, patients cannot breathe through their nose very well, and they resort to mouth breathing. And if you have it taped, you're actually making things worse. So it should be a nightly evaluation by the patient, to the point where, should I tape tonight or should I not? Even if it's worked in the past, doesn't mean it's a 365 a day and times a year type of scenario. So be cautious.
Yeah. So in terms of timing, if there is anyone in the audience who has questions, don't be shy, ask away. We don't have these opportunities so often to speak to someone like yourself. So do put it in the comments. While, if anyone's waiting for that, in the meantime, what I think would be a really cool question in my head is, let's say somebody watching this thinks they might have sleep apnea. Could you give like a super basic, simple, like step-by-step guide of what they should be thinking to do?
So I know this might vary country to country, and there's different pathways in each particular country's medical system, but you want to get a sleep study. And if you go online, like you had mentioned, there's a Stop Bang, which is a kind of a primitive thing. It's a pre-screener. There are more involved questionnaires, and I can provide that to anybody who wants to email me, that goes more in depth. And you know, oh yeah, that is me. Oh, I do have that. You know, and all of a sudden it brings to the surface more aspects that is a deeper dive that would, you know, give you the propensity that you may have it, which then would facilitate a discussion with your doctors. Hey, I have this, and this going on. Plus my bed partner says I stopped breathing, and I also am suffering from blood pressure and have AFib and have acid reflux. So basically all these things put in a bundle, your hand serving to them and say, yes, I agree. Let's get you a home sleep test. And then therefore you want to have a normal night's sleep in your own bed. Do not take any sleep aids. We recommend taking sleep studies in their own bed, because if the patient does snore, they're elbowed by the bed partner, it wakes them up. And if you're up, you're not having events, and it's going to underscore in your home sleep test. So it's really important. I know people are using Oura Rings and Fitbits. Those are not medical grade. They can pre-screen and give you some ideas, but the algorithms on those are not medical grade, to the point where it may say, hey, this person's not moving, so we're assuming they're having deep sleep or REM. When actuality in stage 2 sleep out of stage 4, you could be misdiagnosed of having deep sleep or REM. So we take those with a grain of salt, but be honest with yourself and ask yourself, are you tired at the end of the day? Are you using caffeine as a stimulant? Try going through a couple days after you wean yourself off without caffeine or 5-hour energy drink and see how you respond. If your body's relying on that, you may say hey, I love the taste of it. Go to decaf if you love the taste of it, and then see how your performance is that day. And if you find yourself crashing at 1 or 2 o'clock, obviously it's something to think about. But it also is based on your nutrition, like you said, and the previous night's sleep if you stayed up too late and doing work. So try to find the hours, but we're finding out that 7.5 hours is really the sweet spot. And yes, you can get by on 4.5, but did you provide your brain and body enough quality time to make you the most efficient version of yourself the next day, if that makes sense?
And 2 points on that is to add as well. So I put in my post today, you don't have time to sleep, but you do have time to be tired. And I asked a lot of people, do you really have time to be tired? Because it's an interesting philosophical question to ask. Another thing that might help people when it comes to nighttime procrastination, be it phones, things like this, is would you do this task in the morning? Or would you wake up early to do this? Because let's say you're watching Netflix at nighttime. Would you wake up early to do that? If the answer is no, then why are you doing it? So I stole that from Bjorn. He mentioned that, so just to give the credit. But I think it's a very interesting question to ask ourselves. Would you do that? Would you wake up early to do that? If the answer is no, then why are you doing it at nighttime?
Absolutely.
So this has been super, super fascinating, interesting for me. For people who would like to learn more about you, where can they reach you?
Well, my email address would be dave.federici@comcast.net. That's my personal email. So if anybody has questions or wants a copy of my questionnaire, I'd be more than happy to lend it out, and they can just take off my banner with my practice. You can go online. The key is take everything with a grain of salt. Look for your data-backed, evidence-based studies, and not this is the hottest trend, unfortunately. Maintain your neutrality. Unfortunately, people will try to skew and find the one tidbit that they want to pounce on in a study and disregard the other scenarios. So again, I think for seeing who we're signing up and these people who are business owners and have employees, I think it's very important to check on their efficiency and ask them, are my employees as efficient as they could be today? Should I investigate your sleep? I see you're drinking a lot of coffee. I want you tired. I mean, employees who are efficient are going to make you more productive, right? And any way you can help your employees, if it involves even spending a little bit of money to help them out if they can't swing it for therapy, it's going to be a good investment in your employees or your trainees. If you're coaching is to make them the most efficient version of themselves to get the best results out.
And I think to add to that, end of the day, I'm always arguing that sleep it isn't costing you money, it makes you money.
Absolutely.
And I don't even need a science to this. It's like, who's going to do the best work today? Me sleep deprived or me well rested? No brainer. There's only one winner.
Right.
Even if the deprived person has an extra hours to work, he ain't catching up. No way. So yeah.
Yep. I want to give kudos to you and all the people that follow you on what you guys are doing, because you are taking a one-on-one approach, and I'm happy to give this little sector of a piece for them to take back. But you guys are making tremendous, advancements in the industry of taking patients individually and training them and coaching them and really taking a good personalized approach. And it's just as important that the person hiring you wants to do this, right? And that's the best customer. Hey, I want to get in better shape. I feel like my life's in the doldrums, and it's just one more piece. Sleep is a third of our life, and we have to make sure that's being done, because it could cancel out the 2/3 during the day that you guys are trying to improve for those patients. And if you're starting with a poor foundation, if somebody's coming in groggy, they're not going to remember half the stuff. It's going to be much harder for them to be successful in what you guys are trying to do. So thank you, and all the trainers and the sleep coaches and the corporate people out there who are doing this, because a national awareness is what we need right now. So kudos to you guys.
Touched, and honestly, fantastic to have you here. I think we'll have to do another discussion maybe in a few months' time, because honestly, there's probably a lot more I could ask you, but I'm
Part
conscious
2
of time.
to be continued. Thank you for having me.
Thing, when's your next public speech, or when's the next event you might be speaking at?
Faculty lecturer for the American Academy of Dental Sleep Medicine. So we just had our new Philadelphia Sleep Conference I spoke at. I'm trying to think what my next one is. My schedule's so crazy coming up, but yeah, they're all here in the States. I do dental conferences, do sleep conferences. We have our New Jersey State Sleep Symposium here in Princeton every year. I'm on the board of that, so we bring in great speakers. So I do podcasts here and there for different people. So again, if anybody has any questions, just email them to me. If you dave.federici@comcast.net. I've been more than happy to answer any questions after this, or send some screeners, pediatric, chairside, healthful issues, anything that you feel, information on dental sleep appliances. You can reach out to your countries. I know EADSM, European Academy of Dental Sleep Medicine, is a good way for Europeans to reach out to find dental sleep providers. Here in the States, we have the AADSM, which is the American Academy of Dental Sleep Medicine, to find a provider who's qualified to do this. So again, if any questions, feel free to reach out to me.
Awesome. And if we miss any questions, sometimes they don't go through the stream. They might just be sitting there and we haven't seen it. Apologies, but we'll probably look at that and answer anyway. So great. I'm going to end the stream now. Thanks, everybody, and see you soon.
Thank you.